Dalman belongs to the group of respiratory system medications. Dalman is presented in 150 milliliter plastic spray bottles. Dalman water-based nasal spray contains the active ingredient fluticasone propionate. Each bottle contains approximately 120 sprays. You can find the list of excipients in the final section of the video. The information you will hear in this video has been prepared using the official package insert to inform Dalman spray users. If this video is helpful for you, please support the channel by liking the video, subscribing and enabling notifications. Dalman water-based nasal spray is used for specific conditions. Dalman is a corticosteroid medication, commonly known as a cortisone-containing drug. This medication acts locally, meaning it works only inside the nose. Its systemic absorption is very low. Therefore, systemic corticosteroid side effects are usually not seen, and its use is considered safe. Dalman nasal spray is especially preferred to treat allergic rhinitis and inflammation inside the nose. Dalman helps relieve nasal congestion, sneezing, runny nose, nasal itching, and eye symptoms such as itching, redness, and watering caused by allergies. When used regularly, it reduces inflammation in the nasal mucosa and makes breathing easier. How to use Dalman spray. Always use the medication exactly as your doctor prescribed. The recommended dose for adults and children over 12 years old is 2 sprays into each nostril once daily. Your doctor may increase the dose if needed. Do not increase the dose on your own. Before using Dalman spray, you should do the following. Shake the bottle well. If using for the first time, prime the pump by spraying a few times into the air. Clean your nose before use. Correct application steps. Hold the bottle upright. Lean your head slightly forward. Place the spray tip into your nostril, but do not insert it too deeply. Close the other nostril with your finger. While gently breathing in through your nose, press the pump to spray. Repeat the same procedure for the other nostril. Do not tilt your head backward after application. Delay blowing your nose for a few minutes. Onset of effect. Corticosteroid sprays do not work immediately like nasal decongestant drops. It takes time for them to reduce inflammation in the mucosa. The medication usually shows its first effect within 6 to 12 hours. However, full effectiveness may take 3 to 4 days. For this reason, it is important to use the medication regularly. Dalman nasal spray is generally safe. However, use longer than 3 months should be under medical supervision. If you experience nasal irritation, bleeding or injury, stop using the medication. If you miss a dose, skip the forgotten dose. Do not take a double dose to make up for it. Important warnings before using Dalman. Do not use this medication if you are allergic to any of its ingredients. The list of ingredients is in the final section of the video. If you have an infection in your nose, consult your doctor before use. Long-term use may require medical supervision if nasal irritation or bleeding occurs. People with high intraocular pressure should also use this medication with caution. During pregnancy and breastfeeding, consult your doctor before using Dalman spray. Possible side effects of Dalman nasal spray. This medication is generally well tolerated. Mild nosebleeds, sneezing, dryness in the throat, rarely changes in smell or taste. These side effects are usually mild. If a severe condition develops, stop using the medication and consult a doctor. If this video was helpful for you, please like the video and subscribe to the channel. Share your thoughts and experiences about using this medication in the comments section. I wish you healthy days.